But in coming to the Kawasaki disease, they will not present that dreadful, and there also we will be having persistent fevers. But cardiac dysfunction is more appropriately present in misses than Kawasaki's disease. And coming to the investigations, all blood investigations. Coming to the treatment, what the treatments are there? Mainly, we should decrease the inflammation. For hyperinflammation, the steroids are the main treatment according to the CDC guidelines and other protocols which are given, and IVIGs, intravenous immunoglobulins. And they have a fruitful course, and no one had succumbed or deteriorated. Who presented with persistent fever spikes and decreased urine outputs, and who presented with shock. They are classified into three types, that is mild, moderate, and severe multisystem inflammatory syndrome in children. Why it is called multisystem is at least two organs should be involved, and there is multiple organs to be involved. And coming to the cardiac manifestations, which are most commonly seen in misses, children who are sick and require hospitalization definitely should go for the cardiac involvements. That is, they should do ECG should be done every 48 hours. And who are having any rhythm abnormalities, they should definitely go for every 48 hours. They should be taken an echocardiogram. 2D echo is done for any presence of valvular dysfunctions, ventricular dysfunctions, or presence of any pericardial effusions. And for the observation of coronavirus, the severity of coronavirus severity is identified with the help of Z scores. Its Z scores are of between 2.5 to 10. They should be started with anticoagulants, that is aspirin of low dose aspirin 3 to 5 mg per kg. Whereas Z scores more than 10 and the ejection fraction left ventricular ejection fractions, which are commonly seen in misses, which are not seen in Kawasaki's disease. Left ventricular ejection fraction less than 35 or 50 should be started with enoxaparin for at least 2 weeks. Whereas children with severe cardiac aneurysms, coronary artery aneurysms should done CT cardio, and MRI cardiac also should be done in children with severe cardiac dysfunctions. For identification, they should be follow-up, and follow-up should be there with echo after 1 month. Every 2 to 6 weeks, they should be echo should be done, and at the age of 3 months, 6 months, and 1 year of age, echocardiogram. And children who are on follow and who are having rhythm abnormalities previously should be done with the Holder's methods, and ECG should be monitored. And any child who were previously diagnosed as VC, echo should be done after 1 year of age to see any abnormalities which are commonly seen in these children. And then immunomodulatory agents. Children who presented with shock, the first step mechanism is should start with intravenous immunoglobulins 2 gram per kg, and children who present with refractory shock, evidence of multiple IVIGs is not recommended, and steroids should be started with 3 to 5 mg per kg. And if fever spikes are persistent and child is very sick, then pulse steroids can be given. And even though if the child is very sick on ventilator or requiring non-invasive ventilation, some biologicals were started in some patients according to the CDC guidelines, starting of anakinra, whereas the prognosis in these patients are worse. They are trivial, and they are having many other complications, having severe cardiac complications and other multiple organs, like they are having severe fibrosis in the lungs and renal failures in the children. And children who presented with altered sensorium, children who presented with altered sensorium and GCS of poor GCS, and they have shown promising results. And main promising results, the how to prevent this disease is main thing. You should take general precautions. What we are taking for the COVID should be taken. That is prevention of SARS-CoV virus, maintenance of 6 feet distance, and wearing proper mask and maintaining of distance will help to avoid this disease. Thank you.